friends, today we are here to talk about the arteries which are supplying the shoulder or the shoulder joint, or most specifically we can say the glenohumeral joint. So we have the major branches, major blood vessels, then some of these branches, not all the branches but some of the branches of the major blood vessels will supply the shoulder. Okay, so major blood vessels on the right and left both side, we have the subclavian artery which passes the first rib, and then it is called as axillary artery, and axillary artery which is supposed to supply the axilla, that is the underarm. Okay, and then it is continued as a brachial artery. So this axillary artery then passes the teres major muscle, and which is known as or continued as the brachial artery, which then supplies our forearm. Okay, so these are the major blood vessels. Then we have some branches of the axillary artery and subclavian artery, which gives off many branches which supply the shoulder. So starting from the first, that is the superior thoracic artery. Okay, the axillary artery gives off a branch known as superior thoracic artery. So it is a branch of the axillary artery. Okay, and the superior thoracic artery goes down a couple of intercostal spaces, and then it supplies the upper part of the thorax, and also it supplies the subclavius muscle. Okay, this was about the superior thoracic artery. Then axillary artery also gives off another branch called the thoracoacromial artery. Thoraco means thorax, and acromial is the highest point on the shoulder. Okay, that is the acromion process of the scapula. So then thoracoacromial artery also has few branches. These are known as the acromial branch, then the deltoid branch, clavicular branch, and the pectoral branch. So these branches of the thoracoacromial artery, these all supply the shoulder. Okay, the deltoid branch supplies the deltoid muscle, clavicular supplies the clavicle, and supplying acromial branch is supplying the teres major muscle, teres minor, and serratus anterior muscle, and pectoral branch, as the name suggests, it will supply the pectoralis muscles. We have the pectoralis major muscle and pectoralis minor muscle. Okay, these will be supplied by the pectoral branch of the thoracoacromial artery. Then we have a branch of axillary artery known as the lateral thoracic artery. Lateral thoracic artery, it will supply the lateral thoracic wall and serratus anterior, and also it will supply the mammary gland. Okay, and lateral thoracic artery is itself a branch of axillary artery, and it runs along the inferolateral border of the pectoralis minor muscle. ठीक है ना? So next we have the subscapular artery. Subscapular artery is also a branch of the axillary artery itself. Okay, and subscapular artery runs posteriorly in the axilla. Okay, and subscapular artery, actually it gives off two branches, that is the circumflex scapular artery and the thoracodorsal artery, and these both branches takes part in anastomosis around the scapula, which will go into further detail within few minutes. Okay, subscapular artery actually supplies the posterior part of the scapula. These both branches, circumflex and thoracodorsal artery. So subscapularis artery will supply the teres major muscle, latissimus dorsi muscle, and the subscapularis muscle. Okay, and last we also have a thyrocervical trunk. Thyrocervical trunk is also artery, we can say, which will supply the shoulder. So it gives off branches known as the suprascapular artery and dorsal scapular artery, and these both branches will anastomose with the branches of the subscapular artery. Okay, I'll tell you. First, let's complete the branches of the thyrocervical trunk. And thyrocervical trunk is a branch of the subclavian artery. Subclavian artery, we have studied that it passes the first rib and then it is continued as the axillary artery. So that subclavian artery will give off a branch known as the thyrocervical trunk, and then thyrocervical trunk gives off branches known as the suprascapular artery and dorsal scapular artery. Okay, and suprascapular artery will supply the posterior part of the scapula, that is infraspinous and supraspinous fossa. So on the dorsal aspect of the scapula, we have the spine of the scapula, and which divides the dorsal surface of the scapula posteriorly into two fossae. ठीक है ना? One is the supraspinous fossa and other is the infraspinous fossa. So these two fossa, that is supraspinous fossa and infraspinous fossa, these are supplied by the suprascapular artery. Okay, and which is a branch of the thyrocervical trunk. Then we have the dorsal scapular artery. So dorsal scapular artery, a branch of the thyrocervical trunk, and it will supply the levator scapulae muscles. Actually it lies at the medial border of the scapula. So these were both the branches of the thyrocervical trunk, suprascapular artery and dorsal scapular artery, branches of the thyrocervical trunk, which majorly supplies the posterior or the dorsal aspect of the scapula. So now if we talk about the anastomosis around the scapula, the circumflex scapular artery, a branch of the subscapular artery, it will anastomose with the suprascapular artery, which is a branch of the thyrocervical trunk and which is a branch of the subclavian artery. So circumflex scapular artery will anastomose with the suprascapular artery, and thoracodorsal artery, which is also a branch of the subscapular artery, and it will be anastomosed with the dorsal scapular artery. The thoracodorsal artery will anastomose with the dorsal scapular artery. Okay, so thoracodorsal artery, which is a branch of the subscapular artery, it will anastomose with the dorsal scapular artery, which is a branch of the thyrocervical trunk. So in this way, the branches of subscapular artery comes posteriorly to the scapula and anastomoses with the branches of the thyrocervical trunk. In short, circumflex scapular artery will anastomose with the suprascapular artery, and thoracodorsal artery will anastomose with the dorsal scapular artery of the thyrocervical trunk. So this was about the blood supply of the shoulder, arteries of the shoulder. Subclavian artery, which will pass the first rib and be continued as the axillary artery, and then axillary artery will be continued as the brachial artery. Then we have the superior thoracic artery supplying the upper part of the thorax, the thoracoacromial artery, which has branches: acromial branch, deltoid branch, clavicular branch, and the pectoral branch, supplying the pectoralis muscle, teres major minor muscles, and deltoid muscle. And we also have the lateral thoracic artery and the subscapular artery, which are the branches of axillary artery. And lastly, we have the thyrocervical trunk, which is a branch of the subclavian artery. And the branches of thyrocervical trunk, that is the suprascapular artery and dorsal scapular artery, anastomoses with the branches of the subscapular artery. Circumflex scapular artery, anastomoses with the suprascapular artery, and thoracodorsal artery at the inferior angle of the scapula will anastomose with the dorsal scapular artery, okay, of the thyrocervical trunk. So I hope it is useful for you guys. Till then, take care. Until next time.